today. So Alex has a very interesting background. I think he's did his PhD and obtained that PhD in 2019, and he obtained his PhD from the University of Sydney, specifically from the Sydney School of Design and Architecture in design and innovation. And he's before that, I think he was an industrial designer, which is really the kind of job that I think people in biomedical research don't really think about a great deal. We don't have a lot of access to people with that kind of expertise. So Alex joined health pathology at the beginning of, I think, 2022. And I think his background has allowed him to explore many of the new landscapes of design and innovation practice. And he and with the innovation and design team at Health Pathology are currently working across a range of projects that explore design of services and strategy for clinicians and patients both now and into the future. So yes, it's a great pleasure to welcome Alex to the Statewide Biobank today. So Alex, please, yeah, we're really looking forward to hearing about your research. You know, what you've done in the past and what you're currently doing in New South Wales Health Pathology. Thank you.
Fantastic. Thanks, Jennifer, and to the Biobank team for inviting me. And morning, everyone, on the call today. I'm very aware, kind of talking about design and innovation as well, might be probably a bit different to your usual seminar, but hopefully, kind of today it'll be interesting and kind of thought-provoking, and we'll have lots of discussion as we go. I'll be talking about a few different concepts. I'm also aware we might have a variety of levels of knowledge of what we kind of call design and innovation, and we'll kind of cover some of these things today. Also, as we go, I'll have some opportunities for some kind of open interaction and discussion. So feel free to, when we get to those sessions, to either type stuff into the chat or join in with your microphone. As well, also through the session, feel free to throw a question into the chat, and we'll kind of come to those at the end as well. But before I go too much further, I'd also like to acknowledge the traditional owners of the land in which we're meeting here today. I'd also like to extend that acknowledgement to any Aboriginal and Torres Strait Islander people joining us on the call today. I'd like to acknowledge that. I'm coming to you today from Wabaka land, also known as Newcastle. And as Jennifer said there as well, I'm part of the innovation and design team here at New South Wales Health Pathology. So I'd also like to acknowledge particularly our traditional owners, elders past, present and emerging, as well as being amongst the first designers, the first innovators, the first researchers, of which the actual evidence of their design, we can still see those designs today, particularly amongst the, as we've got here, the Brewerina fisheries, evidence of that still today as a design. So a bit about myself. As Jennifer alluded to there, my background is really in design and innovation. My PhD, as Jennifer said there, I suppose my background, I've looked a lot into studying, I've researched, past as an academic. I've done a bit of teaching all around this field of design and innovation. And I've worked primarily over the last 5 years across those landscapes of design that Jennifer mentioned earlier. So things like service design, what we would call, say, strategic design, as well as human-centered design in the public sector, along with kind of some research methodologies like your kind of classic kind of qualitative, you might refer to as a design researcher. And I definitely feel like I've really found my niche in looking at how do we use these methods, particularly to drive improvement in our public sector, and also achieve equitable outcomes with our goals. So thinking about all the people we deliver those services for, how do we help achieve those equitable outcomes? So today's talk is really an appetizer. I'm going to cover a few things. I'm going to talk about what do I mean by design, what do I mean by innovation, and hopefully try and cut through some of the jargon that you do hear. I'm conscious with those labels, particularly you'll hear lots of, you'll hear everything, a huge spectrum of different meanings of design and innovation. So we're going to try and cut through that today. we're going to then talk about how do we think about services. And in brackets there, I've got strategies and systems, and this will make more sense when we get into thinking about what do I mean by a service. And then finally is really a bit of an interactive discussion. We're going to think about some of the challenges that we've got. What makes designing and innovating in services and systems, particularly in our public sector, why is it so difficult? The limitations of today. It's going to be a very brief introduction to all things design and innovation, as well as kind of what we would call a design approach. I'm going to kind of frame today around one of our design frameworks, noting that it's just one picture of how we talk about design. And I'm not going to go into a huge amount of detail around actual designing of services, because that is its own kind of landscape, that's its own discussion, and very much its own profession with lots of ins and outs of things to explore. What we will focus on today is really about design mindsets. And these things are really necessary for those before we go too deep into specific methods or tools, kind of similar to that designing of services point before it. So what do I mean when I talk about design? And I always like to ask this question and say, is this design? Probably before today, you might have seen the title of this presentation and thought, is Alex going to talk to us about kind of designing of furniture and products and fashion and visuals? No, but to answer the question, is this design? Yes, these are a type of design. However, what we've seen, particularly over the last 10 to 15 years, is a real explosion in design and the way it's used. And where this has stemmed from is from lots of academics, researchers and practitioners studying the process of designing, what makes design great and effective, and then applying it in all different contexts. So that's how we've started to see the emergence of these fields like service design, design for systems, and design for futures as well. Where this also came from was looking at what are those components, and there was definitely a lot of work done in this space kind of over the last 10 to 15 years of looking at organisations and the impact design has had, and was able to show the, I suppose, the positive impact that design was able to bring to lots of organisations, whether it be kind of, and I suppose that just distillation of using design as a way to solve complex challenges. At New South Wales Health Pathology, where we've got a small design and innovation team, where we try and design primarily across those levels of services and systems. And we always leverage other disciplines as we go. So we might use something like systems thinking or futures and foresight methods that you might have heard before and build them into our way of working as that kind of design-led way. So what kind of, as I started to talk about there, design has really now shifted to really now think about that broader application in organisations. And design is now really about thinking about how do we improve experiences and outcomes for the people in the system. So thinking about communities and staff. So we design things like services and interactions. We think about the overall construction of systems or configurations of services. We might think about the built environment. Now we do that also here in pathology. We might think about the designs of our labs. And there's also this really interesting space I really like is thinking about how do we use this process to design policy or redesign actually our policies as well. And I'll send through these slides after this session, but you'll see some links here to see where all different organisations are applying this method, whether it be, how do we improve our taxation system? How do we, look at the concepts of, for example, innovative justice, or looking at, for example, how we might improve, I suppose, particular life events, including, for example, the passing of a loved one. How do we improve that interaction with government? So design, one I really like about it and what really drives me is thinking about this, where design methods are at their best. And the thinking and the approach is really that way to help see issues and possibilities in a new way. So design is not just about how things look, it's really at its core how things work and how they're interpreted by people within the system. So the design process, the way we do this is one visualization of the design process. You probably have seen this before if you've done a kind of an intro to design or innovation kind of course or a boot camp. And we sometimes refer to as the double diamond model. This is one way to express the design process. So a few things about here. Probably the key things to remember in that first part of the process is, I suppose overall, is the The diagram is best read left to right. So we've got our first diamond, which is discovering and defining, and then our second diamond, which is around developing and delivering. Now, that first diamond, the shorthand for understanding this is that thinking about that first design diamond is looking at the problem. There's a lot of thinking in our creative process, what problem are we trying to solve? And then that second diamond is really looking at our solution. Now we know what problem we want to solve. How do we figure out lots of different ways to try and solve this problem? And also the reason they're represented as diamonds is to try and show that the type of thinking we're doing. We might do divergent thinking, which is where we go broad. We try and look at lots of different possibilities before we converge, which is where we take all of the different stimulus we might have, whether it be in the problem space or in the solution space, and try and drive down to whether it's a definition of a problem or a really good solution to try and test and take forward. So probably what's not here, I'm really keen to talk about as well, is what's not here is this process is generally deeply iterative. It's never a once-off linear process, and it can be quite interesting when it's for those new to working in a design way, it can kind of seem quite chaotic and rushed. That's often because what we're trying to do is very quickly try and understand problems, define them, develop solutions, and prototype them and try and figure them out, and then try and test them. And then if it doesn't work, we kind of go back to the start. So it's a very iterative process. Also, what's not here, probably this will kind of show that iteration, is it's a deeply human experience. Design is inherently about people, and it's also very collaborative. It's about trying to bring together that holistic kind of cross-section of people to try and solve problems. So hopefully that gives you a bit of an insight into thinking about design as particularly a way to try and, I suppose, a distillation of trying to creatively solve problems and then apply them and develop solutions. And when we design, and kind of as I started to talk about there, when we design as well, being inherently human, we generally like to think about designing as I suppose, involving different levels of participation. Now, traditionally, and this is where design practice and more broadly innovation practice has gone recently, for a very long time, a lot of systems or services were designed at people. Essentially, they were designed top-down, usually by experts. You know, in health, it might be clinicians or scientific experts, and largely that they would make a decision as what's best for everyone. But increasingly, design is kind of going up this spectrum to thinking about how do we design for, how might we design with, and how might actually we be led by others in the design process. And the reason we do this is because sometimes, and I find actually often, designing at people is not a very good way to design. It's often a way to develop a solution that no one's going to use, no one's going to want. So when we're designing for someone, that might involve when we engage with, say, consumers, we might work with patients, we might work with clinicians to actually develop a solution. But largely, a lot of the power of that design still rests with the design team making the decision. When we design with is when it's much more collaborative, as you probably picked up, is where we might actually bring the people we're, I suppose, designing with or designing for into the way we design. So it might actually be involving patients, clinicians, scientists in our labs into actually helping and figure out what is actually going to work for them. So designing with them. And then sometimes, and probably what we don't see a huge amount, is this idea of being led by others. So this is where, as an organisation, we might come across a problem and we might actually, it can be very hard to do, I'll admit, is actually relinquish some control. And we might let other people in the system actually design. And in that way, we actually give them the tools to design and guide. However, we're open to letting them feed what kind of solution they might want to see. So I've talked a lot about design. You're probably thinking, okay, I kind of understand that piece, but what do you mean by innovation? So there is this kind of blurry line by innovation. Hopefully we'll try and cut through some of that jargon today. So by kind of building on what design is, innovation is really about turning bold ideas into reality and to improve outcomes. And so innovation methods, and I'll go through a few of these in a second, can range from understanding reality, so kind of what is, towards more shaping reality, so kind of what could be. And broadly, they can kind of, I suppose, range across methods around empowering people and change amongst individuals or communities, to thinking about how we might actually improve something with a new technology. So broadly, I think kind of sometimes probably a few things of what innovation is not generally. In one sense, I think it's unhelpful to sometimes I see synonymously research and innovation used kind of synonymously when they are really distinct things. And also kind of a trap sometimes we can fall into in thinking about innovation is thinking that it's all technology centered. Technology is definitely one part of innovating, but it's not the focal point of the way we innovate. So I love this diagram here because it kind of hopefully shows what I'm talking about with a kind of a constellation of all of the different innovation methods that you can use. And you can probably see this big kind of blurry bit in the middle where design kind of fits right in the middle. And the reason it sits there and the reason design and innovation are used so synonymously is because design kind of has its foot in every camp. It's kind of part understanding the current state. It's part kind of thinking about the future and changing the future. It obviously also kind of thinks about people, and it also thinks about technology. So when we say kind of design and innovation, that's kind of hopefully shows where those links are there. What's really great about this process and what I love about both design and innovation is it's something that is inherently human and we all do it. So, for example, if you make things, whether it be a document, a workflow, a report, a policy, a meal, you are actually designing. And if you are turning ideas into reality with the goal of trying to improve outcomes, then you are innovating. Because that's just something we all do. So at New South Wales Health Pathology, what we're trying to build a lot of our practice around is using design at the core, combined with lots of other methods to try and drive the way we innovate and actually improve outcomes for everyone in the system, from clinicians to patients to lab staff. So now I've kind of talked high level about design. I've kind of talked about innovation. I'm kind of really keen to go a level deeper into thinking about a specific type of design. And this relates to some of the work and originally kind of where Jennifer and I cross paths is thinking about services, thinking about what is the overall design of the service. And I've got in brackets there strategy and systems. And the reason that hopefully will become clear through this presentation really shows how interlinked all these different concepts can be. So a quick kind of 101 on a service. I love a really simple definition. And the one that I use is from Lou Down, who does a lot of writing about services, particularly government services. And really kind of in plain English, like kind of thinking about a service is something that helps someone do something. So I suppose probably the key things to pull out there is thinking about what is the thing and who is the person, who is someone. What is the thing we're doing to help that person accomplish a goal or do something? So with that in mind, I'd like to introduce you to kind of one of the first of 4 concepts that I'm going to kind of talk today. And I hope you kind of take away from today in thinking about the way you think about services, in all the services that we're involved in, is this idea of outside-in thinking. So I find in my practice, it's often very limiting to define a service using internal organizational language. And the reason is that a lot of the times it doesn't capture the someone, doesn't capture the value that you're trying to help that person do, that thing, amongst kind of a few other reasons. And when we're design-led, we always start with the people. So what we like to do when we're thinking about a service, thinking about the services you provide, is, I suppose I like to ask this question is, how would the people you serve and the tasks that you're helping people achieve, how would they describe the service? It's a good way to, I think, put a name to that service. One of the other reasons we do that is because people interacting with us, whether they be clinicians or patients, they can't see inside our organisation. So they don't. Then a lot of the times, particularly with our whole service or our whole organisation, they think of it as one cohesive service. So how would they describe it? Also, what we see a lot in, I suppose, in pathology, while we might not be sometimes delivering a service direct to the patient, we might be, say, delivering it to a clinician. It's also really important to think about what are those flow-on effects of the service, and then where does the actual, I suppose, value or change happen. And a lot of times it's thinking about what is the end user or the end beneficiary of the service. So for us, while we might be delivering services, say, to a clinician, thinking about what is that flow-on effect down to our patients in this case. So I was thinking about this in preparation for this presentation, and I suppose the biobank was interesting. I did kind of a crash course with Google on biobanking. And I suppose I'd like to kind of open up this question and thinking about who are the people you deliver services for. So I'd like to open this question up to the room, and feel free to add into the chat. How would the individuals who, whether they donate to the biobank, whether they're researchers, whether they're university institutes, how would they describe their service from the biobank? Really keen to hear from the biobank team. How would they frame it up?
Alex, it's a very good question. I can probably talk faster than I can write. I think that's something that we all think a lot about. How do the people that we're here to serve, what do they think of us? And we've actually just launched a survey yesterday of all of our current research clients to ask them about, how do they find the services that we're providing?
Mm.
So I think that was just yesterday, Mike, that we sent that out.
Fantastic.
Correct,
Thanks,
yes,
Dave.
but we've yet to send it out. We're just doing some final touches.
Right, yeah, so it's
maybe we'll get some thought-provoking discussion, and we might even adjust it.
I think it's often challenging, though, I think, for biobanks to actually know this, how are we actually providing the services that people want and need,
Absolutely. No, thanks for that, Jennifer and Michael. And yeah, really interesting kind of topic, and a really interesting point to start thinking about the services that you're involved in. How would someone outside describe them as a service? So over the weekend, I did some thinking, and I started with this very dumb Google search into just why does someone biobank? And there were some interesting responses just on the first page of Google, and it turned out to be a really interesting one. Particularly, I suppose I focused more on the people who, for example, donate to a biobank. And there was many reasons, very complex reasons why someone chooses to donate to a biobank, both kind of individual, both thinking about the system. It was very wild, I suppose, very functional and practical, but then also very deeply emotional. So lots of different reasons. So probably what we're thinking about here is, and probably what I'd like to kind of pass on, is thinking very much about that service linked to that person, but then also thinking about that deep value that you're providing to them, whether it's practical or emotional. Also, I'd probably like to add into thinking about this complexity, while we're thinking about people in our services, another kind of common concept that we use in thinking about our services is this idea of lenses. So this is where we might apply a lens over our service to think about whether it's based on identity or geography, to help us think about services differently. So an example of that, a very simple example of that, might be geography. You might think about, while I'm providing a service to a clinician in a metro area, how am I providing that service to, say, a clinician or a patient in a rural area? Just a really simple way of thinking about how those services are delivered differently. One way that we like to think about it, and this is a tool that's been developed by our collections collaborative inside the organisation, is our dimensions of difference, really to help think about those lenses, particularly more so for our patient-facing services. And we like to call, we've got that kind of big blob in the middle, which is things that matter to everyone. but then thinking about what are some of those unique needs to different patients, to different people across the system. And this obviously has a very much of a collections focus. So for example, how is collections going to be different for an adult thinking versus, for example, a child or an infant is one lens that we might want to apply to, a broad collection service. So I've talked a bit about the people in the system, but I'm kind of keen to talk about all the other bits of services that are involved, because it is more than just people. Sometimes where I can sometimes see people get confused is they definitely kind of associate services with processes here. And that's usually those, however, processes I like to think are parts of services. So processes, when we talk about them, these are the workflows, the routines, the workarounds. These are the things that get the job done. They're the things that enable the service to happen. But there's also lots of other bits. So I'll probably talk to those three in the middle that we haven't covered so far. Talk about places. Where are the physical and digital places that your services are happening? Where are they being delivered? Where are they being experienced by individuals? What are the products that are being used to make up the service, whether they're made by us or whether they're things we procure in to actually make the service happen. And also, who are our external partners? So who else are we working with to try and provide that service? And in health, from what I've observed, it's usually our partners across the New South Wales health system. Probably the one part of people that I haven't touched on too much yet is particularly people what we refer to as kind of front of house or back of house, and we'll go to this kind of through later in the session. But particularly what I mean by that is the staff involved in using the service. It's really, really important to make sure we consider that. And when you're kind of starting to think about your service, you're probably starting to like fill under these buckets of who are all the different people involved. And then usually what I find when I'm doing this is suddenly there's just another realm of people involved. That, there are always people who look after the places. There are people who might manage the digital service. There might be people involved in the procurement of those products. So you can see this kind of, what you think of as quite a small thing as a service can very quickly grow. You can see all of these things influence the successful delivery of a good service. All those kind of people behind all those places, products and partners. So with that kind of in mind, I'm really keen to hear, I know some of the biobank team a little bit, but probably for those who else on the chat, maybe I'd like to kind of add into the chat box window there, what services are you a part of? Kind of thinking about, we've talked about services, we've talked about dimensions of services. I'd love to hear how you would describe the services that you deliver. Education, Jennifer's added one there in around education services. Excellent. Research supporting the biobank. Caesar's added in there around sample processing the biobank, absolutely. Fantastic. These are all really, really great responses. So now we're moving on, and probably you've picked this up when we start to think about this constellation of people involved in a service. But the third concept today to really, I think, effectively think about the services you deliver is to think holistically and systemically. So I think to effectively think about the service you offer, you've got to think about pathology, particularly as pathology and of course the biobank as an interconnected system that is part of a much bigger system, and seeing ourselves where we play in these different systems. I just see a great point added there by Catherine around a service around information services to the ministry and requesting of consumers. Fantastic, great answer. So you can start to see, think big when you're thinking about services and try and manage. I know it can be quite overwhelming when you start to map out all the bits of the service. So I suppose one way to start thinking about this service, and a metaphor we use particularly a lot in service design, is thinking about our services as a stage. So sometimes we think about them as what we might call, to borrow from a theatre, we might talk about our front stage and our backstage. So as you can probably see here, the front stage broadly is all the things those those people we serve can see. These are the things that are visible to them. So that's those people, products, places that I talked to in those last in that last couple of slides. It might be those digital interfaces. Where are they actually doing this step of the process, for example? And then backstage broadly is all the things that they can't see. So these might be the systems, the technology, the infrastructure, even our policies behind all of this that they can't see but affect the delivery of the service. And backstage is also where those support staff are involved. These are the people who not only deliver the service outwards, but then also work with a whole constellation of teams in and doing all the things that keep that service running. So the benefits of why we use service design and why we use this overall design approach is we're trying to firstly improve the outcomes for the people we serve, of course. We're trying to make this easy to use for government. A lot of government services focus on being easy to use. They sometimes call frictionless or seamless. And one that I always like to kind of add as a bit of a challenge is, how could we make government health services delightful? Almost that, I know for probably a lot of health services, you might not want to be a repeat user, but how might we make that experience actually pleasurable and delightful, that it might be even enjoyable? Now, for staff, why this is really good in taking that holistic perspective is it really helps build understanding by the staff delivering the service and management who are often coordinating the service. Really, really helpful there. And there's also huge benefits to doing this approach for the organisation. It finds and often unearths a lot of conflicts and misalignments when particularly we're in big organisations where sometimes bits of the organisations get maybe siloed off. It really helps that alignment between teams. I find mapping that overall process as well helps prompt those hard discussions where there might be some of those conflicts around what will and won't work. But also the flip side of that is it builds relationships across the organisation. And probably one thing that I haven't got here is really as well, it is really interesting role being the designer across these services, because as you can probably tell, this kind of visibility of the whole service, you kind of allowed to kind of float across all of the service. And you actually get this really interesting picture that, for example, no one else can see the whole picture sometimes. So as a designer, a lot of our tasks are actually communicating to all stakeholders what the entire service is going to look like. So some really common tools, and although some not so common service design tools that we use. And again, you might have heard some of these before, are things like service journey maps. You might have heard of like a service blueprint. These are all ways of visualizing services. And even kind of this emerging kind of idea of thinking about services in arcs and loops. And so all these are ways to try and put down this service on a page to try and see the whole picture. Obviously, of course, with different intents in mind as well. And they all have strengths, they all have limitations, and using them together, or even kind of developing a new model, I found can be really helpful based on what question you're actually trying to answer. So a common question that I often get through these sessions as well is probably hearing everything we've talked about today is service design just a new word for managing or management? And the answer is kind of yes and no. Kind of really to touch back on what I said earlier, in a lot of sense, we all do deliver services, and to an extent, we are always all designing the service we're a part of. So there definitely comes down, there is an element of management to this. But I'd like to kind of come back to our framework that we do use to try and underpin all of this work. And usually when we're designing, as opposed to say traditional kind of managing approaches, we usually try to emphasize a greater recognition of the human experience. Like I said, we're trying to see the end-to-end kind of running of that service and where that service fits amongst, in our organisation, maybe many other or dozens of other services that we provide. And then also, because we try and start with problems, it actually makes our solution space a lot bigger. So like kind of I touched on earlier, we spend a lot of time in the front end of design thinking about understanding what's going on and trying to think about how the problem itself would be defined. So I'm probably talk about some of the interesting concepts around service design. I'm probably going to talk now about the last one for today, which is thinking about maybe where services are suboptimal or even service failure. So this last idea to thinking about your service is sub-optimization. And this happens, I see this all the time, is when one part of the system that delivers a service actually undermines another part of the service. And this can be due to a variety of reasons. This can be due to competition between different parts of an organization. It can be through silos. It can be through even just arbitrary measures that might be an organizational way of working or sometimes a policy decision. So you can sometimes these things can happen to actually undermine the delivery of your service. And there's probably lots of times where you can think of where a department or you've been using the health system, for example, or you might be in your work delivering a service where a partner or another department has not thought about the entire service, and then the flow-on effects not just to yourself or to your team, but also to the patient, also to our clinicians. You can see how this kind of can undermine the overall delivery of the service. Some of them can be sometimes quite funny, quite humorous. I kind of quite like this one there. This is where you can see a technology team has clearly not worked with their human experience team, where the technology has driven, say, poor decisions. And this is an example of so you can see here someone requesting a death certificate, and the answer you can answer either for myself or for someone else, where there's a clear mismatch between technology and the people involved in the system. And at worst, sometimes there's not just sub-optimization, there's probably also what we talk a lot about in services, is service failure. So this is when, kind of to put it simply, the service doesn't help someone do that thing they want to do, or it doesn't meet the needs of the organisation. So it's really got to ride those kind of two twin goals there. And what that creates is something you might have heard before called failure demand. So a really easy way I think of failure demand is really all the rework and all the work you've got to do in fixing up a broken service. So it might be something as simple as someone enters their name wrong into a system, and then further down the line, someone's job has got to be going back in and fixing up that name in the service. So you can see that's what we kind of talk about as failure demand. So when we're designing, we try and obviously design to minimise the amount of failure demand as possible, or the chances for error. So I've kind of talked about design, I've talked about innovation, talked about services more broadly. I'm really keen to open up a bit of a discussion in the last kind of 10 to 15 minutes and talk about why designing and innovating, particularly in government services, is so difficult. Because I've talked about kind of methods and processes of getting it done, but I'm really interested in understanding, or talking a little bit about first, and then understanding your perspective as to why isn't good design and good innovation happening. So a few examples that I can talk to. One is the mindset that we've got to take when I think when we're designing, and we're trying to actually, and the complexity and the challenge here is we're trying to actually flip a lot of established ways of working when we're doing good design and good innovation. So traditionally, lots of services get created in this way. So they might start with an operational goal, and that goal might be to save costs, for example. And then they might, as a result of that driver, they might then make some operational changes. And then the service and the implications of that service are kind of forced on the customer, the patient, the staff, clinician, kind of happens to them. That's kind of that old way we talked a lot at the start of the session, designing at people. Because what we're actually trying to do is flip that around and start with people at the core of our process. Understand the diversity of needs and goals of consumers, of patients, of clinicians, of staff, and what goals they're trying to achieve and what outcomes they want. Working backwards from that and applying a deliberate design approach to the service, and then aligning those with the organisation and trying to make that fit between people, particularly in strategy, a lot better. And also trying to align all that back-end processes, that back-of-stage stuff that I talked about earlier, with the front-of-stage interactions. Second reason why I think it can be really tough to design services, particularly in government, is our level of insight. What I've seen a lot in my experience in government services, again, conscious I've only been in kind of health for about a year now. What I find government services are great at, they're great doing organisations, and they're great at actually getting things out the door, providing, for example, a service. However, sometimes where I sometimes see government services fall down is that kind of lack of insight. And what I mean by insight is a deep understanding of those people at the core of the system. What are they trying to do? Why are they trying to do it? And how can we help them do that? And so really, I think a lot of government organisations and government services have got to evolve from what I'd say just the doing of the service to actually becoming a learning organisation. So I mean, you know, we actually then we want to know, we want to learn more so we can actually do better, and really building in our processes to accomplish that. I know these are, of course, much easier said than done, of course. Also, we have a lot of, I suppose, we have different challenges that, say, for example, our private sector colleagues might not might not have. And for us as an organisation, for example, as a health service, we have to deliver all of our services equitably to all the different communities we've got here in New South Wales. And we're also accountable to lots of different people. So you can start to see the challenge of what we've got ahead of us. And this can also make designing services very difficult, particularly when you've got, you know, finite resources and trying to deliver and be accountable to so many people. Also, as you probably picked up as well, probably through this theme, is this idea of complexity. I think public sector services are incredibly complicated. As you kind of start to see here, and hopefully as you've picked up from today, services are very much sit within strategies, and of course with us sit within systems, and then kind of permeating through all of this is a layer of policy that we've always got to navigate. And so this is where actually I think also our innovation and design methods have got to get smarter. And even I'll probably refer to some of the tools that I've talked about today in thinking about services and mapping, definitely have their origin, particularly in kind of technology-led kind of private sector startup kind of thinking. They've really got to be tailored and evolved to work within our public sector. And finally, probably the last one before I open it up to the room is we've also got to build, I suppose I like to think, the methods and spaces to safely take risks, to enable all of those things we've talked about, particularly that idea of being a learning organisation and understanding more about the world we deliver services in. And this is something we actually, in pathology, we're actually doing right now. We're definitely working and actioning on this one as we speak. And so you can see here, this is on the right here is our health prototyping centre. So this is a space that has been built in inner North Sydney in Macquarie Park, which is a space where we can do these things. We can test out ideas, we can build things, so we can actually learn. So then hopefully we can deliver better. So really great space we've got set up there, and I'll send through the link again after this session. So if you're interested in kind of coming onto that space or using that space in pathology, please feel free to reach out to myself. So I'm really keen now to kind of open it up. I know we've got about 15 or so minutes to go. What do you think are the other barriers to that, you know, make designing and innovating difficult, whether they be generally, but also maybe just in health or just in the health system?
Thanks, Alex. That's been so interesting so far. I think if people want to just put up their hand or jump off mute and make comments,